Cyprus has been trying to introduce a universal coverage system in the last years, and to this end we are designing a new national health system which will be evolving around the patient and not around the health professional. The plan is to place the patient in the center of all this system and give the patient the opportunity to choose the health professional who will be offering services to the patient, not just at the primary level, but at all levels of health. In other words, we are creating a unified market within which both public and private hospitals will compete for the preference of the people, of the patients. So we need to prepare and expose the people working in the public hospitals to a private sector environment and teach them how to apply principles of customer care, accounting, invoicing, budgeting. So all in all, I would say it's a 4 to 5 year plan, which will also include, apart from the process of the autonomization of our hospitals and the introduction of the national healthcare system itself, to apply e-health all over the place with a general uniform pattern for an electronic medical record for all Cypriot citizens and other residents. We will also introduce a dedicated regulator for pharmaceuticals in Cyprus, as well as try to enhance the collaboration between medical schools at the universities and public and private hospitals. One of the biggest advantages of Cyprus is its geography. We are where we are, so we benefit from trading with Northern Africa, the Middle East, Asia, and Europe over centuries. The use of the English language is quite extensive on the island, and our universities are geared to cater not only for the local population, but especially for the periphery. In this region, and given our special association with Britain, we've seen that one of the fields for potential growth is education at large, but also medical education and other health-related professions. And given the fact that we are based and we have modeled our systems on the British standards, we could act as a middle ground between UK and countries like Iran, Iraq, Jordan, in general the Gulf region countries, but also Northern Africa countries. Furthermore, the high standard of the health service industry in Cyprus in general offers opportunities for training and expertise on professionals as well. So we could provide training for nurses or other health professionals from the region who wouldn't want to spend the time in other European countries. They could come to Cyprus and get the best out of both worlds. Through the cross-border directive of the European Union, we can take advantage of the experience and the expertise existing in other EU jurisdictions with whom we work closely. Let me give you one simple example. A proper hepatological center, transplant center for liver transplant, requires a minimum of 20 to 25 transplants per annum. In Cyprus, we have 4 to 6 per annum. So by definition, it is impossible to create a liver transplant center in Cyprus of a very high standing because the numbers are not there. So instead of wasting money to create such a center, we are investing the same amount of money in, let's say, preparing a hepatological center which will prepare our transplant patients for a transplant operation, let's say in Paris, ship them out to have the proper transplant in Paris, and ship them right back in to receive the post-surgical treatment. This will secure a high standard of service to our nationals, while at the same time it will allow us to use and utilize our resources with a much more effective result. Recently, we've received a lot of direct investment in the health field, especially in medical centers which specialize in oncology, radiotherapy, or other specialized fields of medicine. We have a new oncology center now that is being constructed. It will be finished soon, that plans to extend its services to countries in North Africa and the region, the Gulf region. And there is a huge potential there for a new market. Pharmaceuticals are, especially on the generic medicines, are doing very well. And this is a result of the fact that we have a high number of tertiary education graduates who are usually required in the field of pharmaceuticals, but also the flexibility of the industry itself here in Cyprus. Now, what we're trying to do is to try to associate the fields of education, research and development with the pharmaceutical industry, and also introduce new methods or new elements to this equation, which will allow the field to expand even further. One of these possible new developments would include, or could include, the introduction of legislation which will allow the cultivation and use of cannabis for medicinal purposes. I honestly believe that this legislation would attract not only foreign investors who would be interested in engaging in the cultivation of the plants themselves, but also a lot of startups on research and development, and then hopefully maybe some global pharmaceuticals who would be interested in investing in the commercial exploitation of certain findings of these research companies. The good thing is that now that we are taking care of our local needs, we come to realize that the existing infrastructure, along with the expertise that has been coming to Cyprus through the repatriation of our medical students and other health professionals, provide a good opportunity where people from neighboring countries could come in and receive high standard medical services at a fraction of the cost of other European markets. But apart from the medical services themselves, we could have a number of other medicinal tourism opportunities in auxiliary fields, like, for example, the rehabilitation field. Cyprus, with this weather and these conditions, can offer a great alternative to existing rehabilitation systems from other European countries or even region. We could offer much better rehabilitation services than many other European countries at a much lower cost. And I would urge people who are looking for investment opportunities in Cyprus to look at the rehabilitation field quite closely. The construction of small one-bedroom residences for older people by the sea, probably under the sun, with the support of a small medical center or hospital, which can cater for all their needs, especially aquatherapy, physiotherapy, and things like that, could provide a good place of choice for residency for third age people. It's high time to see what Europe already has and try to enhance and invest in our own region so that we can make the best out of what each country can offer. That was the initial idea, and we should focus on it. I would invite people to come over if they haven't been already and see Cyprus not just as a place of holiday, but also as a place of business, because I honestly believe that it can become a gateway to the region, the Middle East and North Africa, and there is a huge market out there which can be attracted to do business with Europe.